If the members will please take their seats and log into the system. Members, will you please take your seats and log into the voting system? Anyone need any more time? Madam Clerk, you will open the board for roll call. Has every member voted? Does anyone need more time? Madam Clerk, you'll close the board and announce the quorum if we have.
Mr. Chairman, you have 18 members present. You have a quorum.
Thank you, Madam Clerk. Good afternoon. Today's Wednesday, March 31st, 2026. I hereby call state and local government to order. Do any of the members have any announcements or personal orders? The chair will take privilege. We have several bills. We have several members presenting bills in other committees, so you'll see some get up and go and some come in. I'm going to do my best to try to get to as many as possible. I do have some bills that we're going to have to take up first because the Senate's kind of waiting on us to do that. So we have 92 bills today on the regular calendar, 7 bills on the consent calendar. So at this time, we'll take up the consent calendar first. We have a proper motion and second on the consent calendar. Does anyone want to be recognized on the consent calendar? Vice Chairman Wright.
Thank you, Mr. Chairman. Item number 4, House Bill 2641, I wish to bump from consent.
All right. Without objection, we'll bump number 4. Let's see. All right, let's go to the regular calendar. Okay, yeah. Does anybody have anything else they want to bump off consent? Seeing none, we're ready to vote on the consent calendar. All those in favor, please vote yes on the board. Opposed, no. Madam Clerk, you will open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board and announce the vote.
Mr. Chairman, you have 19 ayes. You have a quorum.
Bill moves on to calendar and rules. All right, we're going to start with 2402 by Representative Reeves.
Item 32.
It'll be item 32. Got a proper motion and second. Is Reeves in here? I do not see him. Without objection, we'll roll to call the chair. Let's 1711.
Number 38.
Go to item 38. Is Representative Davis here? Skip. We'll roll that to the call of the chair. 2219.
37.
We'll go to item 37. I don't see Representative Garrett, so we'll move to the next one. 1710.
39. We can take that.
Item 39. All right. This is Chairman Powers. Got a proper motion and second. Chairman Powers, I see we have an amendment. Would you please give us your drafting code?
Yes, thank you, Mr. Chairman. Drafting code 016345.
Motion on the amendment.
Got a proper motion and a second on the amendment. Would you like us to place the amendment on the bill for discussion?
I would, please.
Without objection, we're voting on Amendment 16375 going on to House Bill 1710. All those in favor, please say aye. Opposed, no. Your bill's now amended. You're recognized.
Thank you, Mr. Chairman. House Bill 1710 requires all Tennessee state and local governments to verify U.S. citizenship or lawful presence before giving out taxpayer-funded benefits to applicants that are 18 and over. Currently, tax-funded benefits are not consistently limited to lawful residents, and uneven enforcement allows some local governments to avoid accountability. These gaps undermine public trust and responsible use of taxpayer dollars. House Bill 1710 has been amended with input from departments and agencies to ensure that no private information can identify children or families can be provided or utilized. This bill ensures that our state's physical security and enforces compliance through penalties, strengthens coordination with immigration authorities, and preserves emergency and disaster exemptions. And with that, Mr. Chairman, I renew my motion. Be glad to take any questions.
You've heard the explanation of the sponsor. Are there any questions for the sponsor? Representative Powell.
Thank you, Mr. Chairman. Before I ask questions, is there anybody on the list to testify?
There is.
Could we go out of session, please, to hear them?
Do we have a John Walkington? Come on up to the table, sir. Without objection, we'll go out of session to hear from our guest. Sir, give us your name, who you're with, and you'll have 3 minutes.
Thank you. Good afternoon. Thank you for the opportunity to speak today. My name is John Workington, and I live in Knox County. I'm a retired primary care and public health physician and retired from Tennessee Department of Health. I opposed House Bill 1710 for several reasons. Number one, immigrants are being targeted by this bill. The bill targets immigrants through an immigration status verification process imposed upon all 89 rural and 6 metro health departments in Tennessee. Local public health services are available to all persons within the state, including U.S. citizens, as well as immigrants with various types of immigration status. Throughout my entire career in public health, over 30 years, U.S. citizenship or immigration status was not collected by health departments of any person presenting for services. Number two, discrimination in healthcare. This bill will codify discrimination in healthcare. For example, if 2 adult patients, one a U.S. citizen, the other an immigrant without requisite verification, present at a public health tuberculosis clinic, both would receive healthcare services during their first visit. However, only the U.S. citizen would be treated for the full 4 to 6 months or possibly up to 2 years to establish a cure of their disease. Public health staff would be prohibited from continuing to treat the undocumented immigrant. Incomplete or substandard treatment on the basis of immigration status is not an option for healthcare providers, and it is unethical. Number three, violation of federal law. The federal law known as HIPAA prohibits the release of protected health information of any person without that person's consent. Currently, any employee of a local health department who violates HIPAA may be disciplined up to termination, and both the employee and the agency may be sued by a patient. Number 4, unfunded costs. The fiscal note attached to House Bill 1710 fails to take into account staff training and data management within local health departments, which are expected to absorb the burden of this statewide mandate. Such costs are not insignificant. Number 5, staff resignations. An unintended consequence of House Bill 1710 may be the resignations of many frontline employees in local health departments. Nurses who provide public health services are deeply committed to serving any and every patient in need without discrimination for any reason, including immigration status. I believe that many nurses who have dedicated their entire careers to such service, who have extensive knowledge and experience, will retire or move on in protest against this mandate. Public health as a professional field is unable to compete financially with hospitals to recruit nurses. Number 6, intimidation of immigrants. Passage of this bill will seriously compromise any remaining trust immigrants may have in local health departments, among other agencies. Failure to provide needed services to anyone in a community can jeopardize not only individual health, but also public health for the entire community.
Mr. Walker,
And lastly,
that is your,
can I
3
have my
minutes.
last sentence?
go
Please?
ahead.
Thank you. It appears that time constraints and pressure imposed on the Tennessee General Assembly are being used to rationalize a failure to carefully research the potential impact and unintended consequences
Mr.
of this
Walkington, your 3
legislation.
minutes is up. Does anybody have any question for the guest? Representative Powell?
Thank you, and I appreciate your statements. This bill greatly concerns me as well. Can you speak a little bit more to the fact of how, medical professionals are, have an oath to treat all people in need, and how, sometimes even simple things like somebody that's in an emergency situation, would you also be prevented from treating somebody in an emergency situation without properly verifying their citizenship?
Mr.
Under this bill?
Wilkington?
You would not be prevented based on citizenship, no, sir.
So if somebody,
Representative Powell?
so if somebody came in and they were in an emergency situation, could you, under this bill, if it passed, you could not treat, the way I read this, you could not treat somebody until you verified their citizenship status?
Based,
Mr. Walkington?
thank you, sir. Based on my reading of the text of the bill, it's not clear to me if that's possible.
Any other questions for our guest? Representative Miller?
Thank you, Mr. Chairman, and thank you for your presentation. You started your statement with an example of tuberculosis. Could you repeat that?
That statement?
Mr. Walkington, you're recognized.
Yes.
This bill will codify discrimination in healthcare. For example, if 2 adult patients, and the bill states age 18 and older, right? One a U.S. citizen, the other an immigrant without requisite verification, present at a public health tuberculosis or TB clinic, both would receive healthcare services during the first visit, according to the bill. However, only the U.S. citizen would be treated for the full 4 to 6 months, or possibly much longer time, required for cure. The bill prohibits further services if the verification doesn't come through. So when it comes to tuberculosis, which I worked in for 30 years, I was the state TB control officer. Only the U.S. citizen would be treated after that first visit.
Representative Miller?
Thank you, Mr. Chairman. So that individual not getting that second treatment could possibly just die.
Absolutely. And people in this state, including infants, still die of tuberculosis.
Another question.
Representative Miller?
Thank you, Mr. Chairman. Based on this example, if there's non-citizens, let's say, that could possibly have a community disease out there, and if that's possible, but they are prevented out of fear of this kind of law or bill, say, well, I'm not going to get any help at all. I'm not going to this clinic, knowing that I could possibly have some disease. Would you say that person is just out there and could actually spread that kind of disease. Is that?
Mr. Walkington, you're recognized.
Thank you, sir. Absolutely, that's true. And that pertains both to U.S. citizens who have communicable diseases and don't have health insurance, or they are afraid of going to a doctor, period. There are a lot of people like that. And undocumented persons as well. So communicable disease spreads in communities by people who may have symptoms, maybe not, but have an active disease which can be communicated to another. And TB, for an example, is communicated through the air. If one of us in this room, if I had active TB and I was speaking to each of you, you could be exposed to me right now as we sit here and not know it. So that is a risk that it's being taken with this bill, in my opinion.
Thank you. Thank you,
Any
sir.
more questions for our sponsor, our guest? Seeing none, we'll go back in session. Thank you for being with us today. First on my list is Representative Dixie. We're back in session.
Thank you, Mr. Chairman. I just was trying to be a gentleman. This is to the sponsor. This is this bill, we have these continual attacks on a certain segment of people. And I think that we're forgetting that we're supposed to be here to make people's lives better. We're trying to keep people out of school. We're attacking their health care. And I think that we have to understand this land is our land together. And I don't remember, probably back when we was in the second grade, maybe even first grade, there was a song that we learned called "This Land Is Your Land." And I'll repeat those lyrics real quick. It says, "This land is your land. This land is my land. From California to the New York Island, from the Redwood Forest to the Gulf Stream waters, this land was made for you and me. But now it's not made for you and me, it's just made for thee." So I would ask you let's stop the attacks on people. If someone needs help, we need to give them that. No one is abusing the system, because most people here that will be targeted are here working, trying to make a living, trying to do something better, put their family in a better situation. We're doing things, we already have things in place in a police state where they are trying to get out the most violent of the violent criminals. But this is not a reason for this bill. And I don't think that they're a drain on our economy, or they're a drain when these people are contributing to our economy. So I would hope that you would consider not even running this bill, because it makes no sense to continue to target a segment of people. So please consider what we're doing here and the implications. And I ask my colleagues to think of this. We have to stop the attack. As one of my colleagues said in a meeting earlier, is sometimes you have to stop the violence, and you have to decide that the violence stops with me. So thank you, Mr. Chairman.
Representative Mitchell.
Yeah, thank you, Mr. Chairman. Yeah, my questions are for the sponsor. Like several counties in this state own their hospitals. So your legislation would apply to them in a healthcare setting. So are you suggesting that these county hospitals violate federal law if this legislation is passed?
Chairman Powers.
Thank you, Mr. Chairman. There are exemptions for emergencies, like at a hospital, if they're, no matter what their age are, but if they're over 18, then they would be reported as being a non-citizen at that point, but they would be treated for any type of emergency care.
Representative Mitchell.
Would they need to verify their nationality before that care is given?
Chairman Powers.
No, if it's an emergency situation, no, they would not.
Representative Mitchell for a follow-up.
Yeah, and the county health department, that's really troubling to me as well, because, we've got measles going across much of the country now. We've had more measles cases already this year than we had all of last year, and it's only going to get worse because the lack of vaccinations by by our citizens. So are you suggesting that if someone wants to come in and get a vaccination at one of these county health departments that would help create herd immunity to stop the spread of infectious diseases, they shouldn't be able to get that care?
Chairman Powers?
That would also be treated, vaccinations will also be treated under the exemption for emergency situations like that. So they would be able to be treated. If they're over 18, they would be reported as someone being treated that was a non-citizen.
Representative Powell?
Thank you. So based upon this description of the bill, my question is for the sponsor. I mean, essentially, this is going to have a major chilling effect on public health in the state of Tennessee. Under the bill, I see no way that you can avoid the fact that essentially we're going to have to train people that are doctors, nurses, working in this hospital to become immigration enforcement officers. Don't you think that we already have a severe shortage of healthcare workers in this city and the state throughout the entire state of Tennessee? How can you address the fact that by putting this burden on these individuals in public health, how it's going to not have a chilling effect on them wanting to stay in the profession?
Chairman Powers?
I would not consider that. I mean, it would be in any occupation that you might have. If you have someone that is applying for benefits, or if someone is being treated at a hospital, all they have to do, they don't have to become an immigration enforcement officer. All they have to do is send a report. So that would be whether it's a hospital or any other type of business where somebody that was a non-citizen was being treated, or any conducting business of any kind.
Representative Powell, before you go, audience, this is your first warning. Please keep your signs down low enough that the person behind you can see. Representative Powell, you're recognized.
Thank you, Mr. Chairman. My concern here is that this is basically going to open up anyone that is in a healthcare setting to have to go about verifying and anyone's immigration status. Additionally, sometimes you don't know if the person is over or under 18 when they present themselves. So there's also going to be that factor. The biggest concern, though, is that if they do not comply with this and they go about treating somebody as they should, we should treat all people in this country for any sort of health concern. Now they're going to basically risk major public funding if they go about treating somebody. So this is essentially risking these institutions and others to federal funding. So can you speak to how the bill does not get around what the person testified around? This essentially is contradictory to federal policy for treating anyone. Now we're going to have to reject people and risk federal funding.
Chairman Powers.
Thank you, Mr. Chairman. Once again, if it's an emergency situation, it would not be, they would be treated. That's one of the exemptions that were built into it. But every other entity, local health department, whatever, must verify that the applicants are 18 or older, are U.S. citizens, or lawfully present under federal immigration law before providing any federal, state, or local public benefit, unless the federal law prohibits it. So,
for a follow-up.
And I understand the emergency. I still disagree reading the bill. I think that it's not narrow enough for that carve out. But essentially what you're saying is anyone who is providing public health benefits, unless it's an emergency situation, is going to have to check the immigration status of somebody before they can provide care. Is that correct? How does that not contradict federal policy?
Chairman Powers.
Thank you, Mr. Chairman. No, it does not contradict it. If there's a federal law that prohibits that, then it would be built into that, so it wouldn't be contradictory. But they do have to verify whether or not they're here legally before they do receive benefits if it's a non-emergency situation.
Next on the list is Representative Warner.
We roll me one spot, Mr. Chairman, please, sir.
Next on the list is Representative Chisholm.
Thank you, Mr. Chairman. So with this, do we have any concrete stats on the physical impact of caring for these immigrant populations versus allowing people to be sick or injured?
Chairman Powers.
I'm sorry. Could you repeat the last part of that? I'm sorry about.
Well, I guess I'm asking, have we calculated the fiscal impact or the cost of allowing people to be sick or injured versus caring for these populations?
Chairman Powers.
Thank you, Mr. Chairman. I do not have those numbers as far as that type of calculation. No, I do not.
Representative Chisholm.
Okay, because it sounds like we have a solution looking for a problem, and I'm afraid that the fiscal cost is going to outweigh the cost of actually caring for the people in the state of Tennessee. Thank you.
Next on the list, Representative Warner.
Thank you, Mr. Chairman. Move previous question.
Previous question's been called. We do have 3 hands up. We'll be on the board. All those in favor of voting for previous question, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 16 ayes and 6 noes.
Previous question prevails. We're now ready to vote on House Bill 1710. All those in favor, please vote yes on the board. Those opposed, no. Madam Clerk, you'll open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 17 ayes and 6 noes.
Bill moves on to Finance, Ways and Means. Okay, item number 5 on today's agenda. We have a proper motion and second. And Representative Ashley, I do see that we have an amendment. This is House Bill 1718, item number 5. Give us your drafting code, sir.
015289.
That is correct. Would you like us to place it on the amendment the amendment on the bill for discussion?
Yes.
Got a proper motion and second. All those in favor of Amendment 1528-9, going on to House Bill 1718, please say aye. Opposed, no. Bill's now amended. You're recognized on your amended bill.
Thank you, Mr. Chairman. This legislation established a 1-year pilot program at Trousdale Turner Correctional Facility to implement body-worn cameras for correctional officers. The goal of this bill is simple but important: to enhance the safety for both inmates and officers, increase transparency within the facility, provide clear, more reliable evidence in the courtroom. The idea for this legislation came directly from the testimony in the Senate Corrections Subcommittee, where the Trousdale District Attorney shared the real challenges of prosecuting incidents with only stationary camera footage. He described a serious incident in which an officer was pulled into a cell by multiple inmates and repeatedly stabbed. With only fixed camera angles, it was extremely difficult to determine exactly what happened, who was responsible, and what charges should be filed. Body-worn cameras would provide a clear first-hand perspective, helping ensure that justice is accurate, fair, and supported by strong evidence. This legislation will help move us away from he said, she said situations and toward documented objective accounts of the incidents. It also promotes accountability on all sides, as both officers and inmates will know their actions are being recorded. Ultimately, this is about protecting lives, supporting our correctional officers, and strengthening the integrity of our justice system.
You've heard the reading of the sponsor. Does anybody have any questions for the sponsor? Representative McCalman, you're recognized.
Thank you, Mr. Chairman and sponsor. Thank you for bringing the bill. Can you shine some color on the fiscal note, please?
Representative Ashley, you're recognized.
Thank you, Mr. Chairman. It's 359,000, I think. Let's see. Yes, 900.
Representative McCalman.
Thank you, Mr. Chairman. I guess my question is, how do we have such a high fiscal note on that if we're just putting some body cameras? And my understanding is the contractor would be providing their own cameras. Correct me if I'm wrong.
Representative Ashley.
You are correct. Core Civic has agreed to pay the 350 for the body cameras. And at last minute, from this 359,000 was placed on the fiscal note.
Representative McCalman.
Thank you, Mr. Chairman. Any idea as to why we have a $359,000 fiscal note?
Representative Ashley.
Body cameras went up a lot.
Not really. Like I said, it was supposedly placed on the last minute from the commissioner. It doesn't make sense to me.
Representative McCalman
Thank
for
you,
a follow-up.
Thank you, Mr. Chairman. No further questions.
Any other questions for the sponsor? Representative Mitchell.
I'm good, thank you.
Any other questions for the sponsor? Seeing none, we're ready to vote. Where are we? What number? 5?
Yeah.
Okay. Okay. All right. Without objection, we're voting on House Bill 1718, moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 23 ayes and 0 noes.
Bill moves on to Finance, Ways and Means.
Thank you, Mr. Chairman and committee.
32.
All right, we're going to item 32. This is House Bill 2402. Representative Reeves, got a proper motion and second. I do see we have an amendment. Which amendment would you like to run?
Yes, sir. Thank you, Mr. Chairman. I've got 16584.
That is correct. Proper motion and second on the amendment. Would you like us to place the amendment on the bill for discussion?
Yes, sir, I would.
Without objection, we're voting on 16584 going on to House Bill 2402. All those in favor, please say aye. Opposed, no. Your bill's now amended. You're recognized, sir.
Thank you, Mr. Chair, and thank you for your indulgence in bringing this bill up. Colleagues, during the recent ice storms, thousands of Tennesseans lost power and internet and other things, and roads were dangerous, temperatures were life-threatening, and while most people were told to stay home, our utility line workers were told to go out, and they worked in freezing rain and hazardous conditions to restore electricity and broadband and other things to homes, hospitals, water systems, and emergency communication. This bill simply recognizes that reality during declared weather emergencies, and it defines emergency utility line workers and ensures they can get access to restricted areas. It includes them in the definition of first responder for assault protections during those emergencies and provides limited good faith civil immunity while performing restoration work. And with that, I'm open for questions. Thank you, Mr. Chair.
You've heard the explanation of the sponsor. Any questions for the sponsor? Seeing none, we're ready to vote on House Bill 2402. Moving on to judiciary. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 21 ayes and 1 present not voting.
Bill moves on to judiciary.
Thank you, Chair and committee.
Okay, we're going to item 29. Representative Reeves, you got another bill here. This is House Bill 1681. Got a proper motion and second. I don't see any amendments.
Are we on 1681, sir?
Yes,
Thank you. I didn't want to presume. I appreciate it.
that is, we do have an amendment.
We
Please give
do.
us your drafting code.
Yes, sir. I've got 12979.
That is correct. Proper motion and second on the amendment. Would you like us to place the amendment on bill for discussion?
Yes, sir. Thank you.
All those in favor of amendment 12979 going on to House Bill 1681, say aye. Opposed, no. Your bill's now amended. You're recognized.
Thank you, sir. Thank you, Mr. Chair. The amendment that we're adding today came from county trustees, simply clarifies the trustees' role in the infrastructure development district process. And Representative Burkhart carried this original bill last year. He was a big believer in how the IDD tool could benefit cities challenged with infrastructure building. But this bill simply cleans up some of those aspects of the bill, and it's fully permissive. No city or county can be compelled or mandated to use this tool. And it exists to create a public-private partnership with developers in order to build or improve local infrastructure. And with that, I'm open for questions.
Any questions for the sponsor? Seeing none, we're ready to vote on House Bill 1681, moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board and announce the vote.
Mr. Chairman, you have 22 ayes and 0 noes.
Bill moves on to Finance, Ways and Means. Item number 30. This is House Bill 2055 by Representative Reeves. Got a proper motion. Is there a second? Properly second. I do see we have an amendment. Please give us your drafting code.
Yes, sir. Thank you, sir. I've got 15889.
That is correct. Got a proper motion and second on the amendment. Without objection, we'll place Amendment 15889 onto House Bill 2055. All those in favor, please say aye. Opposed, no. Your bill is now amended. You're recognized.
Thank you, Mr. Chair. Members, HB 2055 ensures, it brings Tennessee's state and local government insurance plans consistent with the policy direction we've already adopted in TennCare this very session on coverage for gender transition procedures. And it defines those procedures clearly and draws a bright line and says taxpayer-funded plans should not cover those treatments intended to alter an individual's sex to treat gender dysphoria. And with that, I'm open for questions.
You've heard the explanation of the sponsor. Any questions? Representative Salinas.
Does this include adults as well?
Representative Reeves.
Yeah, it's for any gender transition surgeries. Yes, ma'am.
Representative Salinas.
So even if a doctor and an adult see those treatments necessary, their insurance would not be required to pay for it?
Representative Reeves.
That's what we did in TennCare earlier this session, and that's what this brings us in line with. Yes, ma'am.
Any other questions for the sponsor? Seeing none, we're ready to vote on House Bill 2055, moving on to government operations. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 18 ayes and 5 noes.
Bill moves on to government operations. Item 31. This is House Bill 2073 by Representative Reeves. Representative Reeves, you are recognized on your bill.
Thank you, Mr. Chair. So this bill closes a narrow transparency loophole in Tennessee's lobbying law, and it says, current law says that when a public entity hires a contract lobbyist, the lobbyist must register, but the public entity itself does not have to register as the employer. private companies must register as employers of lobbyists. This simply says that public entities must register as well as lobbyists.
Representative Warner, you're recognized.
Thank you, Mr. Chairman, and thank you, sponsor, for the bill. I'm definitely going to support this. Does this bill in any way affect our state-funded, taxpayer-funded lobbyists?
Representative Reeves.
This does not deal with state entities because we chose to make sure that we're dealing with utility districts and counties and cities, so it does not touch the state.
Thank you, Mr. Chairman.
Representative Powell.
Thank you. And actually, I have no problem with this bill either. I guess my question is, if a city or county was to register, who would actually be the registering person? Would it be the mayor of the city or county? Who would that be?
Representative Reeves.
Yeah, thank you for that question. My understanding is it would be the entity that hires the lobbyist. So if it's the county directly, it'd be the county. If it's a county subsidiary, it'd be the subsidiary.
Any other questions for the sponsor? Seeing none, we're ready to vote on House Bill 2073. Moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 23 ayes and 0 noes.
Bill moves on to Finance, Ways and Means.
Thank you, Chair and Committee.
Okay, item number 38 on today's calendar is Ms. Davis here. We got a proper motion on House Bill 1711. I see lots of amendments. Can you give me the one you want to run?
Thank you, Chairman. So we do. And so I have 2 amendments that need to be added, but the first one that needs to be added rewrites the bill, and that is 016355.
Proper motion and second on the amendment. We'll go ahead without objection and place Amendment 16355 onto House Bill 1711. All those in favor, please say aye. Opposed, no. The ayes have it. Ms. Davis, you're recognized for your next amendment.
Yes, sir. That is 016470.
Proper motion and second. Without objection, we'll place Amendment 16470 onto House Bill 1711. All those in favor, please say aye. Aye. Opposed, no. No. The ayes have it. Your bill is now amended. You're recognized on your amended bill.
Thank you, Mr. Chairman. Thank you, committee. This bill is a reporting bill, and so it's going to require the reporting of the costs of illegal immigration to be gathered and reported to the state annually. It requires all state and local governments to verify lawful status before providing taxpayer-funded benefits and mandates reporting when status cannot be verified. This includes the cost of education, healthcare, law enforcement, and public benefit costs to taxpayers. This bill has been worked on with input from agencies and departments. Also, we have included numerous departments with regard to the mental health and substance abuse services, the Department of Health. I have spoken to numerous nonprofit organizations and education associations as well. And this bill will ensure that our state's fiscal security and enforces compliance. It's going to strengthen coordination with immigration authorities, and it preserves emergency and disaster exemptions. And I know that you had some questions with respect to a bill earlier. I just want to reiterate to people that under the Emergency Medical Treatment and Labor Act, hospitals cannot turn away patients in emergencies, regardless of their immigration status or their ability to pay. And currently, right now, they ask that status when you come into the ER. Also, in our education systems, they ask that status because they ask for birth certificates or acceptable immigration status. And with that, I stand ready for any questions.
Representative Mitchell, you're recognized.
Thank you, Mr. Chairman. and I'm glad you brought up EMTALA. Reagan passed that. He got that passed. He believed in a good immigration system. But you bring up EMTALA, the cost of not giving people care and them waiting until they show up in our emergency rooms across this state is going to be so much more than just giving people basic care on the front end before they get so sick. But with education, is the purpose and intent of your bill is to prevent a child from getting an education that you deem shouldn't be getting an education because it may cost you a nickel?
Representative Davis.
The purpose and the intent of this bill is for us to determine what the costs are in education, in healthcare, in social services. Right now, no data is being collected, so therefore we do not know what those costs are, or if there is any. We have a fiduciary responsibility to know and ensure that we're spending our dollars wisely and how those dollars are being spent. Right now, we don't know. It's just estimates. And this is important to understand. We have unaccompanied minors in DCS care, but we don't know what those costs are to our state agencies. With regard to individuals that are committing crimes that are in our jails and across our state, you can't put a cost attached to someone that has been killed by an illegal drunk driver. But we can determine the cost of incarceration.
Ms. Davis, hang on a second.
Yes, sir.
This is another warning. Please do not shout out from the audience. We're trying to conduct business. Please have decorum. Representative Davis, you're recognized.
Thank you. This is a reporting bill.
Representative Mitchell.
All right, listen up real closely. I'm going to give you the data you're looking for. It's going to be a whole lot more costly to this state to not educate people. You can start building prisons right now. If you're going to have a lot of people on the streets that you're not going to allow to get an education, to have the opportunity to get a job in our workforce and to be a productive citizen, if you'll allow someone the opportunity to become a citizen of this state and this country, it's going to be a whole lot more costly not to educate those people than it is to educate them. And it's a whole lot more costly not to give them health care than to give them health care, because they're going to be on the steps of our emergency rooms running up health care costs for everyone. So what you're doing is cutting off your nose to spite your face, because it's a bigoted piece of legislation. Thank you.
Representative Davis, you're recognized.
This reporting bill does not remove someone's ability to be educated. It does not prevent someone's ability to be medically treated. All it asks for is when someone is a citizen or not, and those numbers to be reported back to the state. It does not ask for any identifiers or any information with regards to that would violate any of those HIPAA regulations or any sort of federal law or federal grant status that I know that some nonprofits have. That is not the intent of the bill. The intent of the bill is to determine the costs. And in order to do that, we just need to know the numbers of people that we are educating that can show status and that cannot.
Representative Mitchell for a final comment.
Yes, it kind of reminds me something from the 30s and 40s. Show me your papers.
Next on our list is Representative McCalman.
Thank you, Mr. Chairman and sponsor. Thank you for bringing the bill. I did want to get some clarification, and you and I have spoken prior on this bill. How does this bill affect, say, our CACs or women's shelters and whatnot?
Representative Davis.
Thank you for that question. We specifically put language in this bill. If you go to the very first page, under, it's subsection B right there. It says a local government, state department or agency, or other entity providing a report pursuant to this part shall not include any identifying information regarding an individual, including the name of the person in a report required by this part. That is done so that way it will not jeopardize any of those federal grant dollars. It will not jeopardize any sort of HIPAA regulations or federal laws. We are looking for a tally, just a number. We're not looking for any identifiers.
Representative McCalman.
Thank you, Mr. Chairman, and sponsor. Again, thank you for the bill. I know you put a lot of work into this and have bent over backwards to get this to this point. So look forward to supporting it.
Thank you.
Next on the list, Representative Powell.
Thank you. So let's back up and talk about emergency care. Here's the scenario that's going to happen in the state of Tennessee. Someone's going to come in for emergency care. Say they were having a heart attack,
Representative Powell.
Yeah, it's on the bill.
Stay on the bill.
She spoke on this, Mr. Chairman, so I'm speaking
but I'm
on the bill.
telling you to stay on the bill.
Okay. Under this bill, if someone came in for emergency care and then they were stabilized, would they not be forced to leave and be subjected to leave that hospital or place that they were at receiving care if they were verified to not be legally present? So would this not take people out of hospitals and put them on the curb?
Representative Davis.
This bill is a reporting bill. This bill states that if a hospital cannot verify the status of someone, that's the number they present in the report versus the number of people that have verified status, whether that's whatever acceptable form that is under. That's what this bill does. It's a reporting bill. So they report the numbers of people that they have been able to verify their citizenship versus not.
Okay. And isn't it
Representative Powell, you're recognized.
Isn't it your intent to basically have reporting? And I say we're just capturing the cost. You're not looking at all the positive benefits that come from immigrants who are extremely important to the fabric of the United States. That the goal of this is to collect this data so it can be turned over to ICE and other federal immigration enforcement agencies so that they can target these nonprofits, they can target these hospitals. Why else would you want to be recording this data?
Representative Davis.
The point and the intent of the bill is to collect data.
Next on our list is Representative Dixie.
All right. Thank you, Mr. Chairman. I just have two questions. Who's going to house this information?
So
Representative Davis.
Thank you. I apologize. If you look at the amendment that rewrites the bill, the way that the information is going to be collected, it's going to be collected whoever submits their report to the state, it'll go through either like for education stuff, it'll go through the Department of Education, and then it'll go to F&A. If it's with regard to safety, then it will, like for corrections, it'll go to our Department of Homeland Security, and they will both finance and then also safety will collect that information and submit the aggregate report to us.
Okay.
Representative Dixie.
Thank you. And then, yes, my last question is, once they collect this data, what's going to be done with the data?
Representative Davis.
It's going to be distributed to the House and to the Senate. And that's what's going to happen with the data. We will then look at it and determine what those costs are, and then from that baseline, we'll determine how we are spending our dollars and where we are spending our dollars.
Next on the list is Representative Butler.
Thank you, Mr. Chairman. Move previous question.
Previous question's been called. I see 3 hands. We are on the board voting on the objection to the previous question. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 17 ayes and 6 noes.
Question is withheld. We're ready to vote on House Bill 1711. Moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 17 ayes and 6 noes.
Bill moves on to Finance, Ways and Means.
Thank you, Chair. Thank you, Committee.
We're going to item 37. Representative Garrett. This is House Bill 2219. Item 27. Does it have an amendment? All right. We do have some amendments. Representative Garrett, can you please give us the numbers you'd like to run?
I sure can, Mr. Chairman. It's 16808.
That is correct. I've got a proper motion and second on the amendment. Would you like us to place the amendment on the bill for discussion?
Yes, Mr. Chairman.
All those in favor of placing amendment number 16808 onto House Bill 2219, say aye. Those opposed, no. Your bill is now amended. You're recognized on your amended bill.
Thank you, Mr. Chairman. 2219 as amended is the piece of legislation that requires our sheriffs to enter into a 287G agreement with our federal government. So our local sheriffs can have delegation authority to enforce our immigration laws. With that, Mr. Chairman, I'll be happy to take.
You've heard the
any questions.
explanation of the sponsor. Are there any questions for the sponsor? Representative Powell.
Thank you, Mr. Chairman. And I don't know if anyone's here to testify, but I do have some questions for the sponsor. So back in 2018, there was a law passed establishing that sanctuary policies are illegal in Tennessee. So since these laws prevent sanctuary policies, what is it that this bill is meant to do that we do not allow now?
Representative Garrett.
Well, unfortunately, we have some cities like Nashville and Memphis that don't want to abide by the law. So this makes sure that we make sure that those sheriff's departments enter into an agreement to enforce our federal laws through the 287G program. So we make sure we don't have sanctuary cities here in the state of Tennessee.
Representative Powell.
Also, last year, I believe it was, we passed a bill that incentivized county sheriffs and other local law enforcement agencies to apply for the 287G program. So they already have the power to do this. So are you simply trying to mandate that localities do this?
Representative Garrett.
Thank you, Mr. Chairman. I hope they have the power, but they need to make sure they have the will to do it. This piece of legislation will make sure they have the will to abide by our federal laws to make sure that individuals like in 2025, we don't have over 11,000 criminal illegal aliens committing crimes against Tennesseans. We don't have 21,000 crimes in 2025 of those that are not supposed to be here. So we hope that they will be able to have the power to do this, but we want to make sure our cities, our sheriffs have the will to make sure they abide by the law in this state.
Representative Powell for a follow-up.
Yes, and it's on this bill, but this is going to cost local jails more money. For example, Knox County, I know the previous bill sponsor was from Knox County, but roughly $140 per day to house an inmate, while ICE does not even reimburse that amount. So basically, we're creating a daily loss. If you wanted to study something, that's something you should study, how these bills are costing our locals more and more money. And so why are we trying to force down this unfunded mandate on locals?
Representative Garrett.
First, I reject the premise that this is an unfunded mandate in its strongest terms, in the fact that cities, our sheriffs, our counties need to abide by the law. For folks that want to break the law, I have no problem whatsoever making sure that the police in this state, those in Nashville and Memphis that want to ignore our immigration laws, to make sure they abide by the law. So I reject the premise that this is going to flood our local jails. If it does, that means we're having more people committing crimes. In this state, we're not soft on crime.
Representative Miller.
Thank you, Mr. Chairman. Mr. Chairman, this question may be standing and sticking with the, the bill itself, Representative Garrett, do you know Stephen Miller?
Representative Garrett, you can answer if you'd like.
I'm not sure what Stephen Miller has to do with this piece of legislation, and I'm not sure Stephen Miller is a very common name. Can you be more specific in your totally irrelevant question?
Representative Miller.
Stephen Miller serves as the top advisor to President Donald Trump, playing a central role in shaping policy, particularly regarding immigration. Miller is recognized as the architect of administration hardline immigration policies, including plans for mass deportation, increased detention facilities, and using the Alien Enemies Act to carry out rapid deportation. Do you know of this Stephen Miller?
Representative Garrett, you can answer if you'd like.
I know who you're referring to, and I'm proud to stand here and support the Trump administration to crack down and fix our illegal immigration system to make sure we rid this state of criminal aliens that commit crimes against our citizens. So yes, I 100% support what this piece of legislation is trying to do to make sure that we don't put criminal illegal aliens over the safety and security of Tennesseans. And if that puts me in the same line of the Trump administration and Stephen Miller, then that's where I'm going to be, because I'm going to make sure we're going to protect. And I know this committee, I know this state, I know this General Assembly wants to put Tennesseans over the criminal aliens that are committing crimes against the citizens of Tennessee.
Thank you, Mr. Chairman.
Okay, next on the list is Representative Martin.
I move the previous question.
Previous question's been called. We will be, hush, listen. Dixie, Representative Dixie. It's fine, we will deal with it. Representative Mitchell.
He's not gonna lie and not get called out.
This is it.
Sick of it. If you're gonna bring this shit, you're gonna answer for it. Exactly. Stand up there and take the question.
Sergeant of Arms, will you remove the lady there in the front row with the green on, please? Beside the lady in the purple. You're out of here. I hate that. You shouldn't have yelled out. You're out of here. You're out of here too. The guy out.
My point. Coward, all of you. This is how democracy works. Sinners!
You're out of here. You're out of here. You're out of here.
Let them speak. This is ridiculous. Let them speak. This is important. Let them speak.
All right. We did have 3 hands up. We're ready to vote on the previous question on the board. All those in favor of the objection to previous question, please vote yes on the board. Those opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you
Bo.
have 17
Bo.
ayes, 5 noes, and 1 present not voting.
Question prevails. We're ready to vote on item House Bill 2219. Moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 17 ayes and 6 noes.
Bill moves on to Finance, Ways and Means. Item number 12, Representative Halsey. Got a proper motion and second. There's no kidding going on here. We're trying to conduct work. Okay, we're on House Bill 0447. Representative Halsey, you are recognized.
Thank you, Mr. Chairman. I have a happy bill.
That's good. I do see we have amendments.
Two
Would
of
you
them, sir.
please give me the drafting code?
Yes, sir. I have two amendments, 016540 and 005128.
All right. Which one would you like us to run first, sir?
Well, just the first one I called out. How's that?
Okay. We got a proper motion and second on amendment 16540 going on to House Bill 0447. Without objection, all those in favor, please say aye. Opposed, no. The ayes have it. We're now on amendment number 5128. Proper motion and second on the amendment. Without objection, we're voting on amendment 5128 going on to House Bill 447. All those in favor, please say aye. Opposed, no. Your bill is now amended and you're recognized.
Thank you, Mr. Chairman, and thank you, committee. I have to straighten out something that came out of the subcommittee. Representative Miller had asked me a question, and I gave you half of it was correct and half of it was incorrect. It would apply to core civic. And the truth is, the outside investigators do investigate in core civic. Institutional investigators are not involved in that process. So this.
Representative Miller, your name was mentioned. Do you have a follow-up? Okay, go ahead, Chairman Halsey.
What this bill does, running TDOC is a difficult thing. Just by nature, when you put 21,000 people and lock them up in a penitentiary and limit their movement and what they can get and what they can receive and what they can't, it is problematic just on its face. So you have a lot of good folks involved in TDOC system, but it also is an avenue and a breeding ground for corruption. And so what this bill does is you have 57 investigators in the system for TDOC. And this bill takes those 57 bodies, leaves them exactly where they're at, but puts them under the umbrella of the Discipline Oversight Committee that we established 3 years ago. Therefore, their answers, these investigators' answers, do not go to TDOC. The data doesn't go to TDOC. When they investigate crime, it doesn't go to TDOC. They'll eventually see it. But it goes to the Discipline Oversight Committee, who's operated by a investigative supervisor. And so the pay is going to be the same. The people are going to stay in the same place. They just answer to different folks. Now, the reason that that's important is in law enforcement and investigating crime and corruption, you don't ever do it in-house. If you come from a police background and you have a cruiser that gets involved in a wreck with a civilian, your police agency doesn't go investigate that wreck. You call in an outside agency, either THP or local sheriff's department, to come in and do that accident and work that wreck. So you have an unbiased person doing it. It's the same thing with criminal activity. If you have a police officer who's involved in corruption, you don't investigate him in your own police department. You call like the TBI to come in and investigate that. So that's what this does. TDOC is the only one that I know that does this, that has inside criminal conduct that is investigated by inside people. So this just takes those investigators and puts them under a different umbrella to answer in their investigations. That's what the bill does.
Okay, before we take questions, we need to do a little housekeeping. We do have the amendment that makes the bill. You did not give us that drafting code. It's 03756. We need to place that on. Got a proper motion in second. Without objection, we're placing amendment 03756 onto House Bill 0447. All those in favor? Those opposed, no. All right. The amendment's now on the bill, and I would ask that the three amendments that we placed on to be rolled into one amendment. All those in favor of that, please say aye. Opposed, no. All right. Questions for Mr. Halsey? Representative Howe.
Thank you, Chairman, and thank you for this bill. We've had many discussions about the situation with these investigators and TDOC. In looking at the original fiscal note, it says not significant. But when you go to the committee analysis, it says other fiscal impact. Moving the 54 positions who are investigators, and it says approximately 4.5 million. I'm assuming that's the money that's already there, paying those 54 positions, and that money is going to move with them. That would be my assumption. Is that what you understand?
That's what I understand.
Representative Halsey, you're recognized.
Thank you. That's what I understand. I've got an appointment actually with physical review to find out the answer to that. But that's what I see as a total cost and movement from one agency to another.
Chairman Howe.
Thank you, Mr. Chairman. And yes, I had that same conversation with fiscal review, and they didn't give me a direct answer, but that's my assumption that that's what's happening. So I hope that is the case, because this is something that we're needed in Tennessee. Thank you.
Any other questions for the sponsor? Representative McCalman.
Thank you, Mr. Chairman and sponsor. Thank you for bringing this bill. You and I had a chance to talk about it a little earlier before committee. I think it's a great bill. I mean, we're essentially removing the ability for the fox to guard the hen house. So good bill. Look forward to voting for it, sir.
Thank you.
Representative Halsey, you're recognized.
I was just going to tell the committee things are pretty rough. We've had 35 deaths in institutions just since the 1st of January. That's about one every 3 days. The assaults on staff is higher than it's ever been. The assaults on inmates and rapes on inmates is higher than it's ever been. Suicide and attempted suicide is higher than it's ever been. Again, there's good folks working in that organization. But I think we need to do all we can to try and fix this.
Representative Bricken.
Thank you, Mr. Chairman. And a couple of questions. And I think the legislation makes a lot of sense. Is there any knowledge that you have that previous investigations were being suppressed in the old format?
Chairman Halsey?
Yes, I do. Some intentional, some withheld, some took long times to get information that was asked for. Some real transparent, like it ought to be. But yes, those rumors abound, and the folks who have worked there before in the past have told me that has happened before.
Representative Bricken?
Of the 57 investigators, who will be hiring future investigators or replacements? Will that be this committee, or who will be hiring these investigators?
Chairman Halsey.
Thank you. That's a great question. And yes, it'll be the new committee, specifically under the Director of Investigations, which will be appointed in the bill, be appointed by the Executive Director of the Corrections Committee, but it'll be under the approval, that appointment will be under the approval of the Joint Government Ops Committee.
Representative Bricken.
Last question. Typically, are these investigators detectives, law enforcement, or lawyers? What's the general makeup of these investigators?
Chairman Halsey.
Gee whiz, I really don't have the answer to that. I think they're just folks that have come up through the ranks. I mean, they've been sent to school and investigative school and training, but I really don't know if they're lawyers or carpenters or.
All right. The chairman will take privilege. I've still got people on the list, but I have a very special group that's come in from Northeast Tennessee. It's the Northeast Tennessee GOP members. Would y'all please stand? Let's make them feel welcome. And the one in the blue coat is my lovely wife. So. And then I have a very special friend. He is as good as they get, buddy. He's top notch. And if you get a chance to speak to him and shake his hand, I have Mr. Logan back here. Good to have him with us today. All right, Representative Powell.
Thank you. So my apologies. I haven't spoken to you about this bill. I'm just now seeing it. I was kind of waiting through all the amendments and listening to the questions. So essentially what this bill is doing is moving it out of the TDOC to the special committee that is now going to investigate these incidents. And then per your opening statement with to address Representative Miller, will this committee also investigate incidents that occur at CoreCivic facilities?
Chairman Halsey.
Thank you. And before I answer your question, those folks are my folks too. John's wife is not my wife, but the rest of those people are.
I don't know if I should respond to that or not. I mean, come on.
This group is split. You have outside investigators that they're not housed in the institution, or their workspace is not in the institution. It's divided up into West, Central, and East. They're controlled by a special investigator in charge. There's 3 of those, one for each division. Then there's 4 special agents under each of them. They're outside of the institution, and they would respond to CoreCivic's investigation for crime.
Thanks. And the last person on my list is Representative Moon. Chairman Moon, you're recognized.
Thank you, Mr. Chairman. Chairman Halsey, I've worked with you on Corrections Subcommittee years ago. You spent a lot of your life trying to protect people who have stumbled and fallen, to make sure that they're safe doing their time to repay society. And I want to sincerely thank you. Thank you, Mr. Chairman.
Thank you, sir. Thank you, sir.
Chairman Halsey, is this your last bill in state and local government?
The way the Senate has been killing them, sir, I have no idea. Which brings up, by the way, I have one more bill that I have to take off notice, but I just wanted to make a statement about it.
Well, the committee says bon voyage, so there you go. Any other questions for the sponsor? Seeing none, we're ready to vote on House Bill 447. Moving on to, well, hang on just a second. I do have some people that are signed up to speak. Is Elizabeth Foey here? How about Ashley Fuga? I hope I didn't butcher that too bad. Without objection, we'll go out of session to hear from our guest. And Miss Ashley, give us your name, who you're with, in 3 minutes.
Okay, thank you, Chairman. Ashley Fuquay, Legislative Director, Tennessee Department of Correction. Chairman Halsey and I have talked about this bill since last year. So I'm just here to let the committee know we are opposed to legislation. I know I've talked to multiple individuals here. From our perspective, looking at this is shifting our Office of Investigations and Conduct, along with those institutional investigators, and select of our sergeants, corporals, to the IDOB, which was established to review sentence credits. So this legislation substantially expands the staff of the IDOB and their obligatory obligations while removing that from us. While this bill does take those 54, 57 individuals from our department, there are other groups. So that still does leave some of our investigators that are some of those special agents or contraband type investigators that will be at our agency. The actual job duties of many of the individuals referenced in this bill have also been reallocated. So while especially those that are the sergeants, the corporals are doing discipline, they also do have other jobs outside of just the discipline. So we're looking at it from perspective of, we think there might be duplication of effort, information that wouldn't be shared, and we have expressed those concerns to the representative.
All right. Thank you for being with us today. Representative Warner, you have a question for our guest?
Thank you, Mr. Chairman, and thank you, ma'am, for being here. If I understood you right, your opening statement was you were against this bill?
Well, sir, I'm sorry.
You're
Chairman.
recognized.
Sorry, Chairman. The department is opposed. We're looking at it from a duplication of efforts, from maybe a misunderstanding of what these individuals are doing outside of just discipline, and from the fact that, you know, our investigators are looking into these issues, and we do feel like they are being fair and transparent and honest in those investigations. Just looking, when you're looking at some of this leaves individuals still at our department, not just that are moving to the IDOB. There are more than these individuals that are doing these types of investigations.
Representative Warner for follow-up.
Yeah, a couple there, Mr. Chairman, please. Was you aware, was you paying attention when he gave the statistics out of how many people's dying in our prisons?
You're recognized.
Yes, sir.
There's one, he said
Representative
one
Warner.
every third day.
I don't know that it's one every 3 days, but I do have that this year, there have been 42 deaths in the prisons.
Is that acceptable to the Tennessee Department of Corrections?
I would say the Department of Corrections doesn't want there to be any deaths in the prisons.
But then I think it's time that we give this a bill like this a chance to see if we can't fix some of these problems. And this is what bothers me about being down here a lot. It's people, the departments coming in and testifying against what the people of this state want. And that bothers me when we have taxpayer-funded lobbyists, which you are, to come in here and testify against something that the people of this state want and try to make this state better. So, but thank you for being here.
Any other questions for our guest? Seeing none, we'll go back into session. Thank you for being with us today. And we're ready to vote. Chairman Halsey, you're recognized.
Thank you, Mr. Chairman. I just want you all to know, and you probably found this true, Ms. Fuquay has always been very, very helpful in answers and data you try to get. She's always been responsive, and I appreciate that.
All right, we're ready to vote now on House Bill 0447. Moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. No. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 23 ayes and 0 noes.
Bill moves on to Finance, Ways and Means. Somebody should have put at least one red mark up there.
Yeah, I thought so too.
You're recognized.
House Bill 58, that was my ballot access bill, straight up constitutional bill. Senate just trampled it in the dirt, so I'd like to take it off notice.
I got to get my composure here. 2613 is now off notice.
Thank you, committee and chair.
Chairman Sapicki. Item number 14. Got to get him taken care of and back to education. This is House Bill 1497. I do see that we have a couple of amendments. Which one would you like to run?
Thank you, Mr. Chairman. Should be 014946.
That is correct. Would you like us to place it on the bill for discussion?
Yes, sir, Mr. Chairman.
Without objection, we're placing Amendment 14946 on the House Bill 1497. All those in favor, please say aye. Those opposed, no. Your bill is now amended. You're recognized on your amended bill.
Thank you, Mr. Chairman. Just to clarify, I am here recruiting for education, so I'll be looking for volunteers at the end of my stint here. Mr. Chairman, this bill is very simple. It is an election bill. It does two things. Number one, it guarantees maximum voter turnout in our elections. And number two, it syncs up all elections in the August-November primary in general. It moves all the municipal elections to those 2 times. Therefore, the people of Tennessee know that there is 1 time or 2 times during the year they're going to vote, once in August and once in November. It does have a fiscal note that saves a considerable amount of money to our municipals. That's what the bill does, Mr. Chairman.
All right. Representative Martin.
Yeah, thank you, Chairman Chairman Spicki. Y'all look so much alike. And so when
out of order.
Do you have any bills left in education?
Fortunately, I think they're through. Thank you. Now, here's my question for you, Chairman Spicki. So like if, I get what you're saying about the primary of August and the election November, but in many of the municipalities, they are nonpartisan. So would they be in November? Would they be in August? Or would there be discretion for the cities in that?
Chairman Sapicki.
In the bill, it gives them the option to choose which one they want.
Thank you.
Representative Powell.
Thank you. You've had some good practice already answering my questions, but I'll restate a few of my concerns with the bill and you can address them. But so in the municipal government that I represent here in Nashville, we have off-year elections. And the number one thing I hear is people complain about the length of our ballots and how they just are so long and there's voter drop-off. The biggest thing, though, is in Nashville, besides having these off-year elections, we also have a runoff. So what this bill would essentially do is, if, say you had the election in August, then typically there is a 6-week runoff. Now you would have to wait until November to have that runoff. Or if you had you would essentially be forcing people to have their election in August and then a runoff in November. Or the opposite, if they had it in November, then the city would then have to be paying for a separate election, which would make the runoff even lower voter turnout. So my concern with this is specifically with these city elections runoffs, these council members, some of the seats are filled and then you have the runoff. So there would be a 3-month delay before these elections were decided, which is essentially a fourth of the year you're going for some of my city city council members in those districts not having elected officials. So could you speak to that and how that is addressed in this bill? Because I still don't see a solution to that.
Chairman Safiki.
Thank you. And you may have to go to legal to see if the caption of this bill would handle it, but I would consider a friendly amendment to do away with runoff elections in the state of Tennessee would be fine.
Representative Powell.
Well, so then how, I guess, if you didn't have a runoff election, you would essentially, if you had a candidate, let's say you had 10 candidates for the executive position, mayor of Nashville, then essentially you could have somebody receive a very small plurality of votes and then be over the entire city, which I think is contradictory to having the will of the voters and the majority then come back and decide who their county or city executive is going to be. So the whole point of this is we have runoff elections so that you can narrow those top 2. We're going to have to look at things like what I think has already been restricted from the law, but essentially have ranked choice voting. I mean, so you're going to leave cities with very few options to elect our city officials and leaders. So that's my concern. And essentially, and we can go out of session to hear from legal, but I think this bill completely would override city charters that already exist, and they would have to completely redo their charters because it's in their charter to hold these elections when they're held. If we could go out of session to hear from legal on that.
Without objection, we'll go out of session. Legal, you are recognized.
Thank you. Matt Money from Legal. Representative Powell, was your question specifically about the amendment of city charters to facilitate this bill?
Yeah, so would this not override city charters that have been set up to have elections when they're held by certain municipalities or?
Yes, it requires all cities, including metro governments, to have their elections either in the August or the November election. So if, for instance, Metro would have to probably hold a referendum and amend their charter, other cities would have to amend their charters. Well, by whatever means they amend their charter, for instance, private act charters may require some local bills.
Okay, one other follow-up for legal. What about, how would, if this bill goes into effect at passage, you already have city officials that are rolling off in 2027. Would this not force them to extend their term for another year? How else do you fill these positions if this goes into effect and you can't have an election in an off year?
To correct myself, the general law would supersede the private act. So I don't think that each city with a private act charter would have to run a local bill to change their election dates. To your question, the bill provides for the extension of terms until they can hold an election in accordance with the provisions of the bill.
All right. Representative Martin, do you have a question for legal?
Yeah.
Go ahead, sir.
Mr. Mundy, is it possible are there cities that have partisan elections or are they all nonpartisan? And is that permissible? I'm sorry.
Generally, statewide municipal elections are nonpartisan.
Is it permissible for them to be partisan or is that prohibited by the law is my question.
If it allows for it in their charter, they could be partisan.
Thank you.
Representative Miller for legal.
Thank you, Mr. Chairman. The question is this bill permissive?
This bill is mandatory, Representative Miller.
All right. I don't see anybody else for legal, so we'll go back in session. And first, I've got Representative Butler.
Thank you, Mr. Chairman. Move previous question.
Previous question's been called. We're ready to vote on House Bill 1497, moving out to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, you'll close the board and announce the vote.
Mr. Chairman, you have 16 ayes and 7 noes.
Bill moves on to Finance, Ways and Means.
Thank you, Mr. Chairman.
Item number 15, House Bill 1884 by Chairman Sapicki. Proper motion and second. I do see we have his amendments. Please give us your drafting code.
Drafting code 015548, Mr. Chairman.
Okay, hang on just a second. That's good. All right. We're going to go with 15548. Do I have a motion and second on the amendment? Proper motion and second. Without objection, we'll place amendment 15548 onto House Bill 1884. All those in favor, please say aye. Those opposed, no. Your bill's now amended. You're recognized on your amended bill.
Thank you, Mr. Chairman. Very, very simply, this House Bill 1884 requires a state agency to deny, revoke, or refuse to renew a certification, registration, license, or permit issued to a corporate entity in the state if the state agency receives satisfactory proof that an officer, director, or employee of that corporation provides material support or resources, including providing meeting spaces or other forums such as electronic and print platforms for the purpose of soliciting material support or recruiting new members to, number one, a designated entity, number two, a group that has been found to have engaged in terrorism, or three, a group that receives support from a designated entity. That's what the bill does, Mr. Chairman.
You've heard the explanation of the sponsor. Are there any questions for the sponsor? Seeing none, we're ready to vote on House 1884. Moving on to calendar and rules. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, you'll close the board and announce the vote.
Mr. Chairman, you have 18 ayes and 4 noes.
Bill moves on to calendar and rules. House Bill 1885 by Chairman Sapicki. Proper motion and second. I do see we have amendments. I need a drafting code.
015828, Mr. Chairman.
That is correct. I've got a proper motion and second on the amendment. Without objection, we'll place Amendment 15828 onto House Bill 1885. All those in favor, please say yes. Those opposed, no. The yeses have it. Your bill's now amended. It's good to be the chairman.
Thank you, Mr. Chairman. I appreciate the work you're doing. It's a big calendar. Members, House Bill 1885, I'm going to read this to you because I have to read it because it's very complex. Prohibits the operation or possession of gambling devices and the operation, conducting, or commercial promoting of online or app-based gambling. Establishes a violation of such as an unfair and deceptive act or practice under the Consumer Protection Act of 1977. It expands the investigative authority of the Attorney General and Reporter to investigate unlawful activity relative to illegal gambling. Authorizes the AG to require a person with information relevant to the subject matter of such investigation to file a statement or report in writing about the facts and circumstances concerning the alleged violation and to make available any relevant material and information. Authorizes a civil penalty of not more than $1,000 per document if a person who has received notice of a request for information from the Attorney General removes, conceals, withholds, destroys, mutilates, falsifies, or alters documentary material with the intent to avoid, evade, or prevent compliance with the request. It also requires a TASER study on online sweepstakes games and internet gaming availability in the state, and to prepare a report for the speakers of the Senate and the House of Representatives in regards to regulation and taxation. That's what the bill does.
You've heard the explanation of the sponsor. I do have a couple people signed up to speak if they need to. Is there anybody here? All right, we'll move on. You've heard the explanation of the sponsor. Is there any questions? Seeing none, we're ready to vote on House Bill 1885. Moving on to Finance, Ways, and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board and announce the vote.
Mr. Chairman, you have 21 ayes and 1 present not voting.
Bill moves on to Finance, Ways, and Means.
Thank you, Mr. Chairman, Committee.
Representative Scarborough. Item number 24. Give us just a second. Item 24 on the calendar, House Bill 1870 by Representative Scarborough. Do I have a motion? Proper motion. Is there a second? Properly seconded. Representative Scarborough, I do see we have an amendment. Please give us your drafting code.
16612.
That is correct. Proper motion and second on the amendment. We'll place the amendment on the bill without objection. 16612 goes on to House Bill 1870. All those in favor, please say aye. Opposed, no. Bill's now amended. You're recognized.
Thank you, Mr. Chairman and committee. This is a bill I'm carrying in honor of Jeff Burkhardt. He originally drafted this bill, and it's for the firefighting industry. Reason for the bill is to create a standard of training requirements for fire investigators that are acting as police, as the current statute allows fire chiefs to delegate those responsibilities to fire investigators by mandating training requirements. What that will allow is fire investigators to make arrests and use police powers without training when it comes to arson. This bill will require fire investigators to be post-accredited for police powers. And Mr. Chairman, I do have someone here to stand by for questions.
All right. Would that be Chad Young? Come on up, sir. Without objection, we'll go out of session to hear from our guest, Chad Young. Please give us your name, who you're with, and you'll have 3 minutes.
Thank you for allowing me to speak today. My name is Chad Young. I'm with the Nashville Fire Department. I'm the Deputy Fire Marshal over the Fire Investigations Division. So the current law allows for fire chiefs to delegate police and arrest powers to fire investigators without any mandate of training, no psychological evaluations, no fingerprinting. And what this new law will do is mandate that if the fire chief is going to give police powers and arrest powers to their fire investigators, you will have to be post-certified. So then you will have to have a psychological evaluation. You'll go through fingerprinting. You will have mandated training and in-service yearly through post. That's mandated through post. But this does not take away from anyone still having the ability to investigate fires as long as they don't have the police and arrest powers. You can still go out and investigate fires. And then if it is the act of arson, turn that over to your local police department.
All right. Does anybody have any questions for the guest? Representative Bricken.
Thank you, Mr. Chairman. The general question, if this, and I'll certainly ask this to the sponsor, is the concern that, especially in rural counties that only maybe have 1 or 2 fire investigators, by requiring post-certification, that will require 3 to 5 months for that investigator to be out of pocket. Don't you think it would cause hardships in those rural counties?
You recognize, sir.
Thank you. No, sir. So in giving police powers and arrest powers to those individuals without any training, I think it does a hardship to the citizens and to the department and opens them up to liability without giving them the proper training that's needed to make those physical arrests and to have those police powers.
Representative Bricken.
Has there been any instances of fire investigators causing or arresting or having any issues previously by using their arrest powers?
Mr. Young?
Within the state of Tennessee, I'm not aware. Outside of the state of Tennessee, yes.
So this is really has not been a problem in Tennessee.
You recognize.
Not that I'm aware. I've been in this industry 10 years, so not that I'm aware, but I'm in just Nashville, Davidson County.
Last question. Thanks, Mr. Chairman. Is it possible, instead of having complete post-certification by these investigators, would it not be reasonable to have a modified post or training that would just address some of the issues you're talking about without going to the complete post-certification process?
You recognize.
So currently there's only one standard in the state of Tennessee, and it's to become post-certified. Now, if those individuals wanted to work with post and could create a different pathway and something that post would accept, but you would still have to meet the minimum state standards in the state for post to accept anything.
Any other questions for our guest? Seeing none, we'll go back into session. Thank you for being here today. First on the list is Chairman Moon.
Thank you, Mr. Chairman. To the sponsor, is it not possible in smaller geographic areas of the state that TBI does supply arson investigators?
They do.
Thank you, Mr. Chairman.
Any other questions for the sponsor? Seeing none, we're ready to vote on House Bill 1870. Moving on to calendar and rules. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 20 ayes and 1 no.
Bill moves on to calendar and rules. All right, we're going to take up 2406. Second. 2406, item number 27, I'm sorry. I do see we got a proper motion and second. I do see we have an amendment. Please give us your drafting code.
Mr. Chair, could I roll that to the hill of the calendar?
Without objection, roll to the hill of the calendar. Okay. Clark's. Okay, item number 20, House Bill 2592 by Representative Clark. Oh, he did? Okay. All right, I will roll him one space and we'll go back to Mr. Scarborough. We'll finish your bills. Item 25, House Bill 1906. Proper motion and second. I do see we have an amendment. Can you please give us that drafting code?
013438.
That is correct. Would you like us to place it on the bill for discussion?
Yes, sir. Thank you, Mr. Chairman.
We're now voting on amendment number 13438 going on to House Bill 1906. All those in favor, please say aye. Those opposed, no. The ayes have it. You're now recognized on your amended bill.
This legislation allows members subject to mandatory retirement to receive a retirement credit for periods of disability at no cost to the member. Members subject to mandatory retirement employed by the political subdivision may be granted retirement credit at no cost to the member if the political subdivision adopts a corresponding plan provision. The objectives are, under current law, a member is required to take a lump sum payment of the employee contributions that would normally have been made during the absence plus interest. Allows the following to establish retirement credit for qualifying periods of temporary disability without final cost to the member. Members who are subject to mandatory retirement must submit the application to the retirement system on or after July 1 of 26. And authorize political subdivision to adopt a resolution to establish retirement credit for qualifying periods of temporary disability for members. No member shall be granted retirement credits in excess of 1 year per occurrence of a temporary disability. And then I'll stand by for questions.
You've heard the explanation of the sponsor. Are there any questions for the sponsor? Seeing none, we're ready to vote on House Bill 1906 going on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board and announce the vote.
Mr. Chairman, you have 21 ayes and 0 noes.
Bill moves on to Finance, Ways and Means. Item 26, House Bill 2405. Got a proper motion and second. I do see it has an amendment. Please give us your drafting code.
Zero 15740.
That is correct. We'll place that on the amendment for discussion without objection. I need a motion and second. Okay, proper motion and second. Without objection, we're placing amendment number 15740 onto House Bill 2405. All those in favor, please say aye. Those opposed, no. Madam Clerk, your bill is now amended. You're recognized.
Thank you, Mr. Chairman. The bill is brought by TACP, Tennessee Association of Chiefs of Police, was proposed by the Chief of Laverne Police Department. Members, this bill addresses a situation that unfortunately occurs in law enforcement when an officer suffers a catastrophic injury in the line of duty. When that happens, the officer's life changes permanently. In some cases, officers can no longer continue working, which means the officer and their families may also lose their employer-provided health coverage at the exact moment they need it the most. This legislation ensures that when the officer is catastrophically injured, protecting the public, that their health insurance coverage and their family's coverage does not immediately disappear. We currently have a similar program for officers who are killed in the line of duty, and this bill expands it to those who are catastrophically injured. What this amendment does is the amendment clarifies that health care insurance continuation applies to catastrophic injured officers, the officer's spouse, and the officer's eligible dependent children. This coverage, the coverage can continue up to 2 years after the officer separates the service due to the injury. The ensures the officer and their families have health insurance stability during the difficult transition period. This is covered by both state and local law enforcement officers. The local agency's political subdivision may continue health care coverage to the injured and the family. The state will reimburse the local government for employer's share of the health care insurance premium.
You've heard the explanation of the sponsor. Is there any questions? Representative Powell.
Thank you. A couple questions. Would the dependents roll off after they turn 18, or how would that work?
Representative Scarborough.
That's a great question, and I'm sorry, I don't understand that. I don't know that.
Representative Powell.
Thank you, and I fully support this. One other question I have is just to understand. So they would stay on indefinitely, or is it a 2-year period? You talked about 2 years, so it would just be 2 years that they were able to maintain this?
Representative Scarborough.
This bill ensures they have coverage for up to 2 years.
Okay.
Representative Powell.
Thank you. And I, personally, if somebody was killed in the line of duty, or I know that's already covered, but something like this, a catastrophic injury, I'd almost, think that they should be covered indefinitely. But, and I'd also maybe in the future, we could look at adding firefighters and other first responders to this. So thank you.
Any other questions for the sponsor? Representative Bricken.
Looking at the fiscal note, I was confused. The $800,000 in the next fiscal year for the state, but under local government, it says permissive for the same amount of costs. Can you explain the permissive versus?
Representative Scarborough.
Is that something legal could help me with? I don't have that answer, sir.
Okay.
Okay. We'll go out of session. Legal.
Thank you, Matt Mundy from Legal. I think the answer to your question is because if the locals opt in, then the state reimburses.
Okay.
Go ahead.
So locals do have to, it is permissive for the locals. This will not be mandatory.
Representative Scarborough, I think that question was for you, or is it for legal?
Legal.
Legal, you're
Thank you. It is
recognized.
permissive for the locals.
All right, without objection, we'll go back in session. Any more questions for the sponsor? Representative Powers.
Thank you, Mr. Chairman. Move previous question.
Previous question's been called. We're ready to vote on House Bill 2405, moving out to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 22 ayes and 0 noes.
Bill moves on to Finance, Ways and Means. Item 28. This is House Bill 2407 by Representative Scarborough. Got a proper motion and second. I do see it has an amendment. Please give us your drafting code.
16320.
That is correct. Proper motion and second on the amendment. Without objection, we'll place Amendment 16320 on to House Bill 2407. All those in favor, please say aye. Those opposed, no. The bill is now amended. You're recognized.
Thank you, Mr. Chairman. This bill allows qualified local governments the option to use additional project delivery methods alongside the traditional design bid build process. Current Tennessee law allows TDOT and other public entities such as industrial development boards to use various project delivery methods for construction projects, including the design build method. However, local governments currently do not have the statutory authority to use the same time and cost saving options. If a local government meets the qualifications in the bill, this legislation would provide those additional project delivery mechanisms. The current process has become increasingly lengthy and expensive due to extended project timelines and rising construction costs. As a result, this project costs taxpayers even more. Our bill proposes the option of design build to the project delivery method. It combines both design and construction services under the single contract with one entity. Cities across Tennessee are managing more complex infrastructure project and tighter timelines. Adding this modernized project delivery method as an option for local governments, it will help them complete these projects more efficiently and responsibly. Mr. Chairman, I have some people here to speak to it if you so wish, but I'll stand by for questions.
Representative Butler.
Thank you, Mr. Chairman. Mr. Sponsor, this says local governments having revenues of at least $20 million. So how many local governments will this affect in the state of
Representative
Tennessee?
Scarborough.
I don't know the exact amount, sir, but I know I'll give you, just off the top of my head, we got Chattanooga, Franklin, Oak Ridge, Cleveland, and some of the counties within.
It's going to be quite a few then.
Should be several.
Representative Butler.
So this is going to, thank you, Mr. Chairman. This is going to affect quite a bit of the counties. So this would be a city, a county, any municipality, any government entity essentially would be affected by this bill, right?
Repeat that question one more time, sir.
This will affect a municipality, a city, a county, any government entity would be affected by this bill.
If they meet that criteria.
Any other questions for the sponsor? Representative Butler, are you good? Any other questions? Seeing none, we're ready to vote on House Bill 2407. Moving on to calendar and rules. All those in favor, please vote yes on the board. Those opposed, vote no. Madam Clerk, open the board for voting. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 21 ayes and 1 no.
Bill moves on to calendar and rules. All right, we got a little time, so let's take up.
Mr. Chairman.
No, I want Boyd. Yes, sir, go ahead.
Mr. Chairman, I located that amendment on 2406. If you'd like to run it, go ahead and run it too.
Okay. Which bill are we putting that on? Oh. Okay. We'll take that up later. Representative Boyd. What number? That's item 20. This is item 20 in today's calendar, item 20. This is House Bill 2592 by Chairman Boyd. Do I have a motion and a second? I've got a proper motion and second. Chairman Boyd, I do see that we have an amendment. Please give us your drafting code.
Mr. Chairman, I'm showing drafting code 016758.
That is correct. Without objection, we're placing amendment 16758 onto House Bill 2592. All those in favor, please say aye. Aye. Those opposed, no. You're now on your amended bill, sir.
Thank you, Mr. Chairman. Committee, this bill would give some representation to electrical ratepayers that buy their electricity from a municipally owned local power company. It does have a de minimis threshold of 3,500 members. So whether it be the home county or whether it be a adjoining county that they sell electricity to, the county mayor and it would have to be vetted by the county commission would be able to appoint one board member to the power board. If you are a power authority or if you are a city council operated power company, you would be exempt from this bill. There's a few other things, but that pretty much sums up the bill, Mr. Chairman.
Okay. Does look like we have a speaker signed up. Is there a Jeremy Elrod here? Come on up, sir. Give us your name and who you're with, and you'll have 3 minutes. Without objection, we're out of session to hear from our guest.
Thank you, Mr. Chairman.
excuse me. My name is Jeremy Elrod. I'm with the Tennessee Municipal Electric Power Association. We represent the state's 60 municipal and county-owned electric utilities. As Chairman Boyd stated, this is a statewide bill. Each electric utility across the state is a unique utility and how it governs, the services it offers, where it offers services. I know this bill was filed after Winter Storm Fern. I just want to remind folks that this was an historic storm with historic effects on dozens of utilities across the state, and hit several of them particularly hard in Tennessee and North Mississippi. For Nashville Electric, one of the state's one of the biggest utilities in the state, it took 14 days to get power back on to 230,000 customers, or about half of its customer base. Two smaller cooperatives in West Tennessee took 16 days to get power fully restored, and 5 utilities in Mississippi took even longer. Because of the statewide nature of this bill, and Chairman Boyd, Representative Boyd, has been working with us, we appreciate the de minimis threshold that he has in the legislation. Currently, right now, we are still opposed to it because of the disproportionate representation it has on some of our utility boards. According to our numbers, we think that the bill will affect about 16 utilities, or require about 16 electric utilities to add board members to their board. NES is would have the most board members by how many current board members they have. Currently, they have 5 board members. This would add 4 board members to their board, making it 9. But 4 of those board members will be representing about 12% of their customers, while the other 5% or 5 board members will be representing about 88% of the customers. So I just wanted to throw that. We've been working with Representative Boyd, and he's asked some of the changes we've asked for. He's incorporated the bill, but we want to keep working with Representative Boyd and other legislators to try to get the right. So, thank you, Mr. Chairman.
You've heard the explanation from our guest. Any questions for our guest? Seeing none, thank you for being with us
Thank you, Mr.
today.
Chairman.
We'll go back in session. And first person on the list, Representative Mitchell.
Yeah, thank you, Mr. Chairman. Representative Boyd, do you know how many customers NES has?
Representative Boyd?
I've got it on my, thank you, Mr. Chairman. I have it on my spreadsheet right here. I can look it up, but I think you probably already know the answer.
I'll just give it to you. 406,211. Now, I think you represent Wilson County, if I'm correct. Do you know how many NES customers are in Wilson County?
Representative Boyd.
Thank you, Mr. Chairman. Why don't you tell us?
There's 4,020. So this 3,500 threshold is just a funny number to me, that it just makes sure your county just makes it just right in there to get a seat on the board. But they represent 0.87 of 1% of NES customers. So we're going to give less than 1% of the customers. Like where I live, there's not a person in my house district, I think, on the NES board. But I can tell you, I got a whole lot more than 4,000 ratepayers in my area. We're going to give Williamson County, who's got 10,000 ratepayers, 2.33% of the ratepayers. We're going to give them a board position too. Now we got Sumner County. They got 27,556. They're almost 6%. I can almost see that. That might make some sense. But we're gonna, would you like to lose an election by, you got 88% of the vote and your opponent got 12% of the vote? Should you lose that election?
Representative Boyd, you can answer if you want to.
Thank you, Mr. Chairman. It's funny you say that about the election. You use that example. In this case, I think what we're doing is refusing those people the opportunity to even vote. We're giving them a voice right now because at this moment in time, these people, there's an arbitrary boundary, and the people that live on the outside, they don't get appointed to the board. They pay the rate. They buy their electricity from what is essentially a monopoly. They have no other choice. All this does is it gives them a seat on the board. Now, it's funny because I was talking to Representative McCallum just a moment ago, And we were talking, and so last night I had a conversation with a electrical utility that did not get outside of the county. And so approximately 50% of that utility, because this does have statewide applications, so there are others, conversations around NES, but this utility, about 50% of their ratepayers were in the county and about 50 were in the city limits. They were getting one board member. If this bill passes, that the county, who constitutes 1/2 of the ratepayers, will get one board member. So sometimes that disproportion works in favor of the outside counties, and sometimes it works for the municipality that has the utility. So it's going to be different in every situation, but I would remind you, it has statewide application. And I don't know why everyone is so afraid to give these people a seat on the board. That's all they want.
Final question, Representative Mitchell.
Well, it would be different, but your actions previously concerns the city of Nashville greatly. I don't know how many times we've had to take the state to court and defeat you over and over again, but I'm glad you said it had implications, because I don't think the people at Dixon Electric really are going to appreciate adding 3 board members to their board. I don't think the people at the KUB in Knoxville are going to appreciate adding 3 people to their board. Let's see who else is on the committee here. I don't think, a lot of these systems are going to like adding all these people. Like I said, I don't have one person who lives in my district on the NES board. Do I feel like I was unrepresented? Not at all. Do I feel like it was a historic storm and it was a natural disaster that a lot of things just can't be helped? Yeah. Do you have patience with people? Yeah. You don't act like a United States senator and call up and say, get out here and turn on my lights. No, you worry about your neighbor and make sure your neighbor that, they've got heat, and you take care of the people around you. You take care of your neighbors. You take care of your constituents. You don't come to the state and try to add a board member for your less than 1%. Because you don't deserve that. And you don't deserve that. Represent your constituents and don't try to take over something that you should.
Next on the list is Representative Dixie.
Thank you, Mr. Chairman. Excuse me, that caught me off guard there. Representative Board, have you ever watched I seen a cartoon where someone comes in a venue and they're dressed regular, they get kicked out, and they put on sunglasses and a hat, then they try to come back in? That's exactly what this bill did. We killed this bill last week. And for you to bring it back is disingenuous. I just want to bring something else to my people in Williamson County. Williamson County would have two seats on 2 different boards, one in Dixon and one in Davidson County, the way that it's split. Hamilton County would have people from Georgia on its EPB board. And I think that we need to seriously consider the implications of what happens. Just because right now you may have an issue with Nashville or NES, which I can't understand that, why you always have an issue with Davidson County for something. But this is a travesty, and this will have implications that will devastate a lot of power boards and utilities across the state of Tennessee. So again, we've already seen this cartoon. Why are we watching this rerun again?
Whip boy.
Thank you, Mr. Chairman. It does not, if a local power company provides electricity in another state, they don't get a seat on the board. It only applies to Tennessee counties. And this is not targeted in Nashville. This has statewide implications, as we've mentioned. If you meet the requirements of this bill and you have a utility, a municipal-owned electrical utility in Tennessee, this bill will apply.
Representative Dixie.
I disagree with what you're saying, because that first instance that you used was Davidson County and NES and the snowstorm. So obviously that is the catalyst for this bill. It has nothing to do what happened in Mount Juliet or what happened in Mountain City. It's directly aimed at NES and Davidson County. So it's disingenuous to say, oh, this has statewide implications. Nobody else in statewide has been complaining about this until this happened. We had a hiccup. It happens. You learn from it. You move on. But that's not a way that we have to change the way that we do business just because you don't like it and you guys have the power to change something that doesn't need to be changed. So I would hope that you would think about this and help my colleagues to think about the implications that it's going to have in your counties, and that we would actually do something that will help people, and this will hurt people. Thank you.
Next on the list is Representative Powers.
Thank you, Mr. Chairman. I move previous question.
Previous question's been called. There is objection. 3 hands. We're on the board. We're now voting on previous question. All those in favor, please vote yes. Those opposed, no. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 15 ayes and 7 noes.
We'll now be voting on on the bill, House Bill 2592, moving on to Finance, Ways and Means. All those in favor, please vote yes on the board. Those opposed, vote no on the board. Madam Clerk, open the board. Has every member voted? Does any member wish to change their vote? Madam Clerk, close the board, announce the vote.
Mr. Chairman, you have 12 ayes and 9 noes.
Bill moves on to Finance, Ways and Means.
you,
All
Mr. Chairman,
bills that have not been heard today will be rolled to tomorrow's calendar. We are adjourned.
Motion to adjourn.